Hello and welcome. My name's Adrienne, and this class is all about happy and healthy SI joints, or sacroiliac joints. This is why I brought out my friend Ben here, just to show you the area of the body that I'm talking about so that you can have a good visual picture. And then we're going to do a very short movement practice with exercises designed to either A, possibly help you reduce or relieve SI joint pain that you're currently having, or B, prevent SI joint pain from happening in the future. It is a very common area for a lot of people to experience discomfort and tightness, or even pain ranging from dull and achy to sharp and stabbing. So first, let me show you on Ben here where I'm talking about. So if I spin him around, you can see his spine, and at the base of his spine, there's this bone called your sacrum. It's kind of this triangular bone at the base of your spine. You can even feel it on yourself. It's really big and firm back there. And then your joint, this SI joint, is where the edge of your sacrum connects to your pelvis. So this little divot right here. And you can even feel it on yourself. You know, there's two little divots on either side of the sacrum bone. Those are your sacroiliac joints. It gets its name because sacrum, sacro, and then iliac would be your ilium. So this part of your pelvis, this ridge of your pelvis is called your ilium. So where it meets is your sacroiliac joint. There is not a lot of movement available to this joint, and it's actually pretty stable and strong as far as joints go. A lot of people talk about SI joint stability, but unless you're hypermobile or have connective tissue issues, this joint is actually not going to move that much. It's actually pretty strong and pretty sturdy. We get a lot of pain at this area because a lot of muscles connect to this area. So there can be a lot of potential for strain and pain caused by some muscular tension of the muscles that are connecting to that place. Also, you do have some nerves that kind of innervate and run through here. So if you are getting that sharp and stabbing pain, sometimes that can be an indication that you have a little bit of nerve impingement at that area. So let's go ahead and get to the movement portion of class now that you know where your sacroiliac joint is. Okay, so for this movement practice, you're going to need a small looped mini band. So I have one from Arena Strength here. I like these bands because they're cloth, so it just means that they don't roll as much as plastic ones, but if all you have is a plastic one, that's fine. You can also use a yoga belt. So if you don't have a looped mini band, but you have a yoga belt, you can make a loop with your yoga belt. That'll be roughly the width of your thighs, and then you can also press into the belt. Either one of those are fine. And then you'll also need a block, yoga block. I do recommend having a thicker yoga block, but if you only have a 2-inch one, that's fine. This is a 4-inch one. If you don't have a block, you can use a blanket or a towel or a pillow. And then you'll also need a blanket just to place under your head for some support. So if you need to, you can pause the video, grab what you need, and then meet me back here when you're ready. When you are ready, we're going to go ahead and start on our backs with that blanket folded up to a comfortable thickness for you, and you'll just place the blanket underneath your head. So go ahead and lay down. Lie down and get yourself comfortable. And then you're going to grab your looped mini band and bring it around your thighs. So again, if you're using the strap, you would just wrap the strap around your thighs and then pull it tight so that you have, you know, a hip width distance worth of space, and you can press out into the band or into the strap. And now from here, have your feet so that your heels are right underneath the knees or maybe slightly in front of. Just find a comfortable resting place for them. You're going to place your hands on your hips and see if you can find those two front bony hip points. Just for some frame of reference, you're going to keep your hands there. And then I want you to find a neutral spine. So if you're like me, I'm often really good at kind of lifting my ribs up towards the sky. So I want you to pull those front ribs down and in and try to connect your thoracic spine, or the spine where your rib cage is, to the floor. And then see if you can find a neutral pelvis so that those bony hip points are pointing straight up towards the sky. They're not rotated away from you. They're not rotated towards your face. They're just at a nice neutral position so that you have about an inch worth of space underneath your lower back. And then you're going to hold that and then press your thighs into the band or the strap. And we're just going to hold this. You're not lifting your hips up. You're not doing anything here. You're just going to hold this contraction. This is gently engaging the external rotators of the hip, which are some of the muscles that connect to your sacrum and along that sacroiliac joint area. And you might start to feel an awakening or even a gentle burn or sensation in the outer thighs. You also might even feel it in your groin muscles. So just notice. We're going to hold for 5, 4, 3, 2, 1. Relax. Let your knees knock together. Take a breath. And then we're going to do that one more time. So press into the band, hold, and breathe. Good. Keep holding. I know you're going to start to feel it. We're gently working those muscles that attach to the SI joint areas. Good. Hold for 3, 2, 1, and relax. Go ahead and take that band off your thighs. We are done with the mini band. You can place that off to the side and then grab your block. You're going to place your block in between your thighs with your feet about hip-width distance apart. And then you're just going to squeeze the block as hard as you can with your inner thighs. And again, we're going to hold. Keep breathing as you hold. Notice if you're carrying unnecessary tension in your shoulders or in your jaw or in your neck. Try to relax the upper body as you squeeze and engage with the lower. And hold for 3, 2, and 1. Relax. Now, if that felt like it's enough for you, you can stay in that position. If you want, you can walk your feet out a little bit wider, just so you're going a little deeper into internal rotation. And then again, you're going to squeeze the block as hard as you can. With the band, we were doing external rotation. This, we're doing internal rotation. So the external rotation will actually engage some of those outer glute muscles and put a little bit of pressure on your sacrum. This is actually going to create space and from your sacrum and maybe relieve a little bit of pressure around your sacrum bone or at your sacroiliac joints. Good, and then hold for 3, 2, 1, and relax. Go ahead and take the block out. And then you're going to roll onto one side. So I'm actually going to roll away from the camera just so you can see where I place my thumb. But you're going to roll on to, for me, this is my right side. And I'm going to fold up my blanket just a little bit more so it supports my head. And then you're going to take either your thumb or you can use your knuckles and you're going to find that top SI joint. So if you're lying on your right side, you're going to be looking for your left SI joint. Again, it's that little divot right on the outside of that big bone there, the sacrum. So once you find that, I like to use my thumb, but you're going to keep your bottom knee bent. So again, for me, that's my right leg. And then I'm going to lift my left leg so that there's about a block's worth of distance between my bottom leg and my top. Flex the left foot. And then try to keep your pelvis neutral. So you want those 2 front bony hip points to stay facing straight forward. You don't want them to round up towards your ribs. And then keep that as you bring your left knee, your top knee, in towards your chest. without rounding the lower back. So keep your pelvis neutral and then extend your top leg. And without dumping your pelvis forward, so keep the pelvis neutral, press your left leg back. And then bend the knee, bring the knee in towards your chest, and extend back. And as you're moving, you can search for some different spots along that sacroiliac joint to massage. And you can either just keep gentle pressure there, or you can do kind of little mini circles or a little scrubbing motion. Anything that feels good. And let's do one more. Good, and then come back to center. You're just gonna take your top hand and kind of use your fist to pound out that area right along the sacrum. All the way down to kind of that center of the butt cheek. You might feel a good spot in there. That could be your piriformis if it feels very sensational. And then all the way up and all the way down. Good, and then we're gonna roll on to the other side. So now, you won't be able to see my hand, but you can have a better picture of my top knee as it comes forward. So you're gonna find your sacroiliac joint on this side. I'm laying on my left side, so I'd be finding my right SI joint. And then once you find it, pelvis stays neutral. Bring your top knee in without tucking your pelvis. And then extend the leg and push back. And do that a few times. Remember, you can just hold gentle pressure, or you can do little scrubbing movements or little circular movements. You can use your knuckles, you can use your thumb. Sometimes it's good to do a supported thumb. So if you kind of hug the inside edge of your fingers into your thumb and then use the tip of your thumb, that can add a little bit more support. Remember, you can look for some different places. Good, let's do just one more. And then back to center. Bring that top knee down. And again, you're going to use your fist and just kind of pound out that area along your sacrum bone. If you kind of go to the center of your butt cheek there, you might find some sensational spots. I know I do. And these taps can be as firm or as gentle as you would like. Just bringing some blood flow into that area. Good. And then we're going to make our way up into tabletop position. So go ahead and come on up. If you want, you can use a blanket for cushion underneath your wrists. I'm going to place my blanket off to the side. And then you're going to grab your yoga block. So for this one, you can use a book if you don't have a yoga block. You're going to take, you can also use a firm blanket rolled up too. That'll work fine. But you're going to take your left knee onto the block and then right knee on the floor right next to it. From here, hands are right underneath the shoulders. And then push down through your left knee to lift the right knee up. So the right leg is not doing any work. It's just along for the ride. And then you're going to lower the knee back down. Push down through the left knee into the block to lift the right. And we're going to do that 4 more times. You can also come down onto your forearms to do this if your wrists are feeling sensitive. And try to control this movement through the whole motion. Good, and then on this last one, you're gonna stay lifted and bring your right foot forward into a lunge. Press down through your right foot, slowly come up. Keep those left toes tucked under. And then scoop your tailbone under gently as you plug your right thigh bone back into the hip socket. And then again, I want you to take your thumbs and find your sacroiliac joints on both sides. And then you're going to keep your pelvis neutral. So try not to untuck your tailbone. Try not to tuck your tailbone excessively. And then we're just going to shift forward any amount and then shift back. Shift forward and back. Forward and back. Good, one more. And then bring your hands down to the inside of your right foot. Walk your right foot out. You're going to slide it back. Keep your right leg extended, toes on the floor. Anchor down through your right hand. Now, before we lift, I want you to pull your front ribs up and in. And then bring, if you have enough stability here, bring your left hand to your lower back. Try to let yourself feel your lower back and maybe even get a sense that your lower back is inflating up towards your hand. Keep that and then lift your right leg. So if your back dips, you've gone a little bit too far. If you can keep that and then reach your left hand forward, you can do that, or you can keep your hand on your back if it provides you more feedback. Good. Now, if you have the availability, you can either do this with hand and leg, or you can just do your leg. You're going to tap down and then lift up, tap, and lift. Keep your pelvis neutral the whole time. Good. Last one. You want to feel that right glute working hard. And then lower, and we're going to come to the other side. So take your block underneath your right knee. Tuck those toes under. Hands underneath the shoulders, or again, you can come down to the forearms, although I don't like that position quite as much. But if your wrists are cranky, do what you need to do. Again, you're going to push down into that right knee to lift the left, and then lower. So all the work is coming from that right hip. As you push down through the right knee, you'll also feel your outer right hip draw in towards the midline of your body. Two more. And then on this last one, stay lifted. Step your left foot forward into lunge. Have your right toes curled under. Find your balance as you rise up. Plug your left thigh bone back. Find your neutral pelvis. Thumbs to your sacroiliac joints. And then you're going to lean forward, not letting your tailbone untuck. So you want to keep the front ribs down, and you want to keep your pelvis neutral as you press the hips forward. And then back to center, and we'll do that a couple times. Beautiful. Last one. And then bring your hands down to the inside of your left foot. Walk that left foot out, slide it back. Left leg is now extended, coming into our bird dog. So first, you want to pull the front ribs up and in, and then bring your right hand to your lower back. So you want to keep your lower back just as it is in that neutral position as you lift your left leg. Left foot is flexed. Your toes should point straight down towards the earth. If you want, you can now reach your right hand forward or keep your hand on your lower back. And then you're going to touch down and lift. Touch and lift. Remember, you're trying not to let your belly drop towards the floor. Stay lifted through the lower back. We've got one more. Good, and then back to center. Bring your knee down, hand down. Take the block out from underneath. And then just sit back on your heels. You can also take your block and slide it in between your feet. Sit your hips back on your block. And then just take a moment here. Close your eyes. Big breath in. Big breath out. One more just like that. And then take your hands to your lower back and just give it a very gentle massage. So I'm just using my hands and I'm giving my outer hips a little massage with kind of the heels of my hands, applying gentle pressure from the edges of the sacrum bone there all the way out to the outer hips. And then you can just run your hands down your thighs a couple of times. And that is it for our happy SI joint practice. So I hope that these movements helped relieve any possible discomfort that you're having there. And all of these movements are really great to prevent future SI joint pain and just have a happier and healthier lower back. I hope you enjoyed, and I'll see you in the next class.